Well, good morning, everyone. I hope your morning is off to a good start. Mine is great so far. I'm really excited to have Dr. David Carbonell with us today. Boy, I can't think of a better time to have somebody on talking about anxiety. The world in which we live right now is fraught with events that are causing people or resulting in people feeling lots of anxiety. So I'm really thrilled to have him here today. I think we all need it, myself included. So let me tell you a little bit about Dave Carbonell. First of all, let me tell you, he's just a really good guy. He's generous, he's kind, he's funny. He's part of an improv troupe locally here in the Chicagoland area. If ever you can go see him, please do. So Dave is a clinical psychologist. He specializes in treating anxiety, so that's good and appropriate for today. He's the author of 4 self-help books: Panic Attacks Workbook, The Worry Trick, Fear of Flying Workbook, and the one that we're going to talk a little bit more about today, which is Outsmart Your Anxious Brain, which I love brain science, so this one really speaks to me. I like all of his books, but I really like this one. He is the coach of the popular self-help site anxietycoach.com. He's taught workshops on treatment of anxiety disorders to more than 10,000 therapists in the US and abroad. We thank you because we need this information. He received his doctorate in psychology from DePaul in 1985 and has a local practice here in Chicago since 1990. He's a frequent speaker at annual conferences of Anxiety and Depression Association of America. He uses a blend of what's called cognitive behavioral therapy, acceptance and commitment therapy, metacognitive therapy, and paradoxical methods, which we're going to talk about today, and which I have to say I'm a huge fan. I've started using these because I've read these books. They're phenomenal, and I recommend them to my clients all the time. They're really good. I especially like making a haiku out of our worries. That's my personal favorite. It's his goal for you to leave armed with an approach and several specific tools that you can begin to use immediately. In his spare time, he is a founding member of the Therapy Players, that improv troupe that I was speaking about. So I'm thrilled to have you here today, Dave. We've been able to collaborate over the years. You're just really very pleasant to be with, and you're funny. So, and at a time in our lives when we need something that, kind of helps us in that way. So good morning, welcome.
Oh, good morning. Well, what a start to the day that introduction is. Thank you so much.
We'll record it and send it out to all of your family and friends just so that they know. This is how, I know my kids, they see me as, I'm just.
Family will say, who is that person they're talking about?
Right, exactly. I'd like to get to know them.
Yeah.
So please also, if you're watching, let us know that you're here. Feel free to ask any live questions. That's why we do these live, so that if you have a question, please let us know. We'd be super happy to answer that. So we'll record this whole thing. Will then be available on our website so that you can show your family and friends afterwards. So Dave, obviously, as a therapist, you and I, we understand the language. We're talking about anxiety, but when people talk about anxiety, well, it's a worry. It's the fear of something that's going to actually happen. It's the fear of something that's not actually going to happen. It is your nervous system stuck in an overdrive. How would you define it? Like, when you're telling somebody what anxiety is, what exactly are we all talking about today?
Well, people will experience it in many different ways. And I think, when the average layperson refers to anxiety, unless they're having a lot of trouble with anxiety, they probably don't appreciate what a full body mind experience it can be. That it'll include some powerful physical sensations, which lead people to think, well, there must be something wrong with me physically. Certainly their heart does things, their muscles do things that they don't ordinarily do. They'll be powerful, often oppressive kinds of thoughts that seem to defy their attempts to banish those thoughts. They'll be strong and typically negative emotions associated with the anxiety. And something else that people often don't quite notice at first, there's all kinds of characteristic behaviors of anxiety. So it's very much a multidimensional experience: physical sensations, thoughts, emotions, and behaviors.
Yeah, and since it does involve all of those different systems and all of those different aspects, it's easy to see how people can become really overpowered. And usually by the time someone comes to you or to me, they're so entrenched in their anxiety and their anxiety behaviors that it's really hard to convince them, or not that we're trying to convince them, but to help people understand that they're not necessarily really running from a saber-toothed tiger, or the story you tell in your book about a woman who drives to work every day and she's worried about fainting. And you sort of point out to her that she hasn't fainted in all of these years she's been driving, but it's because her husband's following her. So very entrenched in their behaviors by that point. So you describe anxiety, and I love this, as a counterintuitive problem. Can you say a little bit about that, Dave?
Sure. And the way people become so entrenched in the anxiety, they become entrenched by virtue of all their anti-anxiety efforts. They try and fight it off. They try and distract it away. They try and exercise it away, medicate it away, meditate it away. They get locked into such a struggle with the anxiety. That struggle is what maintains and builds the anxiety. And so that's at the heart of understanding it as a counterintuitive experience. It's people's efforts to protect themselves that make the problem more severe and more permanent. So if you think in general about counterintuitive, well, if you get a little puppy, you bring home a new dog today, and you get home and that puppy gets off the leash and runs down the street, how are you going to get that puppy back? It might seem like you should chase after the puppy, but he's got 4 legs and you got 2. That's not going to work so well. What's really the way to get that puppy back? Run in the opposite direction. And now we're playing chase the owner, and everything will work out fine. That's what it's like to respond to an anxiety disorder. The more you oppose it, the more you solidify it. And so you need some counterintuitive responses, because the anxiety disorders, they're all terribly counterintuitive.
Right. They are very counterintuitive. I love that example. And, the puppy has 4 legs and they're a whole lot younger than I am too. So they have a lot going that I don't necessarily. So how would you describe the worry trick? I love that way of referring to anxiety.
People have worrisome thoughts. They experience typically in the form of a myriad of what if thoughts. What if this? What if that? They have these thoughts of some terrible calamity, and they take that thought as some kind of sign of danger. They take that thought as something that they have to oppose, rather than what I would label it as a form of internal discomfort, as an anxiety symptom. They get tricked by treating the discomfort of an unpleasant thought as if it was a danger. And that's when they get into that counterintuitive business where they're literally opposing their own thoughts. They're telling themselves, stop thinking that. And of course, the more you tell yourself, stop thinking that, the more you're going to be thinking of that which you didn't want to be thinking about.
Right, exactly. Right. Yeah, you ask, is it danger or discomfort? And it feels like danger. So I'm assuming in your work with people, what you're doing is you're helping them understand that it really is more discomfort. And so how is that helpful to notice the difference between danger and discomfort?
It's at the root of everything that you can do productive with chronic anxiety. Because what's good for danger is the opposite of what's good for discomfort. So a person who's in danger, they need to protect themselves. That's a good thing to do about danger. If I'm in danger, I need to run away from it. I need to fight it off. I have to protect myself. If I'm in discomfort and I try and protect myself, that's going to make me feel worse. So this is the fundamental distinction. This is the fork in the road. If I think I'm in danger, I'm going to fight or run. If I think I'm in discomfort, I'm going to find some ways to literally chill out and give it time to pass. Claire Weekes, Australian physician back in the 60s, who wrote all those books that are still widely reprinted today. Hope and health for your nerves, peace for nervous suffering. Her metaphor was float. Float with your anxiety. People often were, sometimes they weren't quite sure, well, what does she mean by float? I think she meant the opposite of swim. Make no effort. Simply allow the environment to support you. That's what you wanted to do with discomfort. With danger, you want to fight or run. So what's good for danger is the opposite of what's good for discomfort. And God forbid if you get fooled into treating your discomfort as danger, that's when you're going to respond in ways that literally make you feel worse. And what a frustrating and bewildering experience that is. People will say, the harder I try, the worse it gets. And it's true, because they're trying to protect themselves when they're not in any danger.
Yeah, exactly. So, Dave, how do you begin to help somebody understand this really, what you believe may happen is likely not going to happen, and that you're dealing with discomfort, you're not dealing with actual danger? What are some of your favorite ways to, in addition to the haiku or the poem, what are some of your favorite ways to help people begin to work on having tools and strategies so that they can get themselves out of that pattern of being so hypervigilant and thinking they're being chased by the saber-toothed tiger?
Well, probably the first set of steps, a client who comes to see me and is convinced, gosh, those sensations I have when I try and drive my car or when I go to a crowded store, they're dangerous. They might kill me. Well, it's not liable to be too much use to say to such a person, oh, actually, there's nothing dangerous about that. That's fine. I have no, they've been struggling with this for quite some time, so I'm not going to tell them, actually, you're wrong and I'm right. This is discomfort. That sounds like a great idea. Dave, you go do that. We're going to start with doing little experiments. And this is how the client can come to reappraise and find for themselves, looking at evidence in their present life. What am I up against here? Is it danger or is it discomfort? Occasionally a client will come to my office and be having a panic attack while we're sitting there. All right, you're having a panic attack on a 10-point scale. Where would you put it? I'm going to ask the client, somebody that's having a panic attack right in front of me. If 10 is the peak and 0 is nothing, where would you say you are now? And let's say a client says, well, I'm at a 6 right now. This is a pretty good panic attack. I'm afraid it's going to get higher. Oh, really? Okay. You want to do an experiment? Okay. Would you see if you can get it to a 7? Would you see if you can get it to a 7? And the client being willing to go, okay, I'll try. Well, guess what happens when they try and get it to a 7? Now they're probably down to a 5.
Right.
I'm trying to raise it and I can't. Well, try a little harder. Oh, now I'm at 4. And so now here's a client who's starting to learn from firsthand experience what a paradoxical thing this is. When I try and increase it, it seems to drop. And when I try and lower it, it seems to increase. My gut instincts are all wrong. I need to play with this rather than protect against it. So I'm going to look for all kinds of little experiments that we can do right there in session that will give the client some firsthand experience of finding out, wow, it works very differently from the way I actually thought it works. No wonder I'm having so much trouble. The harder I try, the worse it gets. I've been trying things that really make it harder. So yeah. I got to try something very different.
I love that. And certainly I've noticed that in my work with people that a lot of the things that I had been trained or thought were helpful just aren't. So what are some of the things that people might be hearing or learning about that really aren't so helpful? If they're listening to a podcast or they're meditating or, what are some of the things that may not be so helpful?
It's amazing to me that this still persists. People are still being told, if you have some unpleasant thoughts, put a rubber band on your wrist and snap that rubber band on your wrist and say, stop. This is perhaps the most unhelpful thing I've ever heard in my life. Don't be doing the rubber band trick.
Don't do the rubber band.
Now people get welts on their wrist and they're still worried. Now they have something else to worry about.
Exactly.
And this is a very specific example of something more broadly that people will get recommended. Stop thinking about it. Distract yourself. Deploy thought stopping. Deploy thought stopping. The moment you tell yourself stop thinking about something, of course, you're thinking about it more. All the research shows that the main effect of thought suppression is thought rebound. But even more obviously, if I tell myself, well, stop thinking about coffee cups, well, that's the last suggestion I've given myself. And if I want to find out, am I doing a good job not thinking about coffee cups, I have to check in with my mind and see, you having any thoughts about coffee cups in there? And now I am. So to be told thought stopping, that's perhaps the most unhelpful thing that people can get in terms of advice. I always like to say the same thing. Thought stopping, don't even think about thought stopping. What else, very closely related to thought stopping, people will be urged to distract themselves in all kinds of ways. Well, this is thought stopping light, and it works just as poorly. None of us control the thoughts that we have in our mind. We don't get to pick and choose what thoughts we have and what thoughts we don't have. The brain's an organ that works on our behalf, just like the stomach is an organ that works on our behalf. And we can't tell the stomach what sounds and motions to make and what not to make. And we can't tell the brain what thoughts to make and not to make. So anything that suggests exert more control over the products of your brain is really a loser. It is very unhelpful kind of advice.
That's great. I love that, because I do hear that from so many people. They'll say, well, I listened to a podcast and this is what was recommended. And a lot of times it is distraction, or might be thought stopping, which is a cognitive behavioral technique. And cognitive behavioral therapy has a lot of evidence to support it, but not in this way. So I love that example of, well, you don't really control how your stomach digests. If you did, nobody would have any stomach issues or disorder. That just isn't the case. So we tend to think that when something is about our mind, or actually our brain, that we should have control over it. And actually we don't. But people who have anxiety, actually, they are under the impression that they have way more control over all kinds of things that they actually don't. So your prescription, so to speak, is a bit of surrender. Is that a fair statement?
Yes, I would call it acceptance. Acceptance of what my brain happens to be producing right now. I'm having a thought, classic ACT phrasing of this is they're always suggesting not so much I'm thinking that I'm going to die now, I'm thinking that I'm at risk now. Rather, I'm having the thought that I'm at risk. I'm having the thought. Yeah, that's okay. I can live with that. And it embodies our recognition that oftentimes we'll have thoughts that aren't true. Doesn't rule them out. We have lots of thoughts that are untrue. I'm having the thought. In the same way that maybe I'm having the sensation of sweaty palms. Well, I'm having sweaty palms. It doesn't mean I'm running out of moisture. It means I'm nervous. And to have the thought, what if I make a fool of myself at the lecture this afternoon? Well, that's not really any important prediction about how I'm going to handle the lecture this afternoon. It's a reminder that I'm feeling nervous now. It means the same thing as sweaty palms. I'm nervous. And that's how we want to respond to it.
Yeah, and for people to realize it, if they can, for what it is. And the part of the what's tricky about this is that the brain really favors survival, any sort of survival mechanism. So I'm assuming that's part of what is getting triggered for people here and what they're responding to. But there are ways to back away from that survival response. So, I love that you talk about safety behaviors safety people, safety objects, support people, ways that people have responded to this instinctual fear that they're believing is about danger. And so they have specific repetitive behaviors. There might be people like the woman who has her husband follow her home or follow her to work, or support objects. You know, I think for a lot of us, it can be our phones feel like a big support object. And you do talk about that. Here it is. It's not far from me, hardly ever. So how do you begin to help people let go of some of those and feel okay doing so?
Well, the woman, that got herself in such a terrible straits, she and her husband, he had a follower in his car anytime she drove at night, because she believed she would faint if she drove at night. And as long as she could look in the rearview mirror and see that her husband was back there, she felt persuaded, I won't faint now. I won't faint while he's there. And she would get to her destination, but at a terrible price of being further confirmed, further reinforced in the belief that if she were to drive at night unaccompanied, she'd have loss of consciousness. Working with her, we set it up as a little research project. And the point of it wasn't to tell her that this wasn't true, but, well, let's examine it. Let's find out, for instance, let's see if we can determine experimentally what is the maximum distance over which your husband can project this anti-fainting power. And so we would have him start following it longer and longer intervals. Ultimately, we found he could project the anti-fainting power from their home, which was kind of a nice outcome. So that's how we do it. We experiment. We don't try and tell the client, here's something that you're thinking that's untrue. I have something better for you. Let's find out. Let's create an experiment. And with her, it started, well, let's have 2 car lights, 2.5 car lights. You go around the block and see what happens. It's all about, let me have an experience where I briefly minimize my reliance on that safety object or safety behavior and find out what happens.
Yeah, so right. And I suspect that's where sometimes when people are listening to apps or talking to a therapist or listening to a podcast or any number of the ways people are getting their information, they're being told what you're doing, you really need to stop doing that. Try this instead. And what you're saying is, well, wait a second, and this makes perfect sense to me, Dave, because the brain needs to have the experience. The emotional survival centers of the brain need to have the experience of something different, not being told, which is going to, sort of hit them right in the frontal cortex. This isn't a thinking problem, right? It's so they can't think their way out of it. Of course, how we think about it, how we hold it is important, but those little experiments are so critical because they get to then experience and see the difference. Versus, well, I'm going to tell you what you're doing is wrong and how to do it properly. Take some breaths now. Breathe this way. Try it that right. And if you can invite them to do that, but have it be an experiment and see what happens, well, then that same tool can be really useful. I love that framework.
Sure, it's so important to allow their brains to come to decide this is safe. This is okay. I can do this, and it's all right. In fact, in some ways, it feels better. You simply tell someone, don't do that, do this. Well, we didn't have to go to school for 6 years to be able to tell people, don't do that, do this. It elicits their resistance. Of course, people don't want to simply take that advice. Parts of their brain are going to be thinking that's not safe. And if you have important parts of your brain that think it's not safe, well, you're not going to participate in that. But when they do the experiment and then they can find out for themselves, oh, this is actually a surprising result. Funny, I feel better as I try and make my panic level go up. Isn't that peculiar? What a shocker that is. But it feels good. Maybe I'll do that the next time. Now they can participate and see this is not only okay, this feels good to me in addition to being safe. So that's how you help people make change. You don't tell them what to do. You invite them to discover something different.
Yeah, that's so critical. I have a relative who was trying to make a career change at one point, and she said, Well, I kind of like the sound of your job. I can sit around all day and tell people what to do. That's easy. I know you can, honey, but it's do that the net, and I love her dearly. She's very sweet. So, right. So really you want to be able to help people. And one of the chapters in your book is the truth will set you free, right? And you really are talking to people much more about the truth, but in an experiential way. You're not just telling them the truth. You're speaking to them and having them learn the truth. So tell us about the truth will set you free.
Yeah, and I have a very particular kind of truth I'm talking about in that chapter. People who struggle with anxiety, it's not enough that they're anxious much of the time and live with a lot of dread. It's not enough that they also find that they have to give up many of the activities in life, the situations, the circumstances, the hobbies, the whatever that they would like to do. On top of all that, they also feel ashamed of themselves for having the anxiety. And so they try and keep it a secret. And they will try and hide their anxiety. They'll disguise it. They'll make excuses for not going to places. That they'll tell lies. That they'll do almost anything to try and prevent people from discovering that they have what they consider to be unreasonable anxiety. And just like being accompanied by support people or support objects, this too is a safety behavior. The more you try and hide and disguise your anxiety, typically the more chronic and difficult kind of problem it's going to be. And so what's the opposite of secrecy? And this is a hard sell. You can't sell it. You can only experiment with it. The opposite of secrecy is self-disclosure. And across the board, as people, in my experience, experiment with self-disclosure, they find out that, gee, actually, when I reveal a little bit of my unpleasant secrets here, do I feel better or do I feel worse? I expect to feel worse. That's why I'm keeping it such a secret. My experience is when people experiment with that, they feel a little better, and that encourages them to do more. But so, put briefly, hiding your fears is the same kind of unproductive safety behavior as is carrying a cell phone, having your spouse with you at all times, wearing your lucky sweater at all times, and so on. It's part of protection that gives you more of a chronic problem.
Yeah, the only ones who get to wear their lucky stuff is sports figures, I think, because it really does make a difference in the game, right?
Yeah.
So one thing I hear from people, we'll have a couple more questions and then we'll have to wrap up because we're almost out of time, Dave. But what if what folks are worrying about is something real?
Well, we come back to, is it danger or is it discomfort? And if it's danger, well, what I have to do for danger is protect myself. And what I have to do for discomfort is not protect myself, chill out, let it pass, let it float in Claire Week's terms. So I usually suggest to people, who are struggling with worry and can't quite decide, is it danger or is it discomfort? They have trouble deciding because they feel afraid and they kind of assume, if I'm afraid, then there is danger. If I'm afraid, then there is danger. This is such a widespread assumption. But all you have to do is read a scary book to find out it's not true. We can become afraid just from reading words printed on a page. But there's this notion, if I'm afraid, then there is danger. So quick two-part test that people can use. The danger that I'm thinking about now, does that indicate a problem in the world around me right now? Is there a problem outside of my mind right now? And if there is there something I can do to change that problem right now? And if you get two yeses, yes, there is a problem outside of my mind right now, and yes, there's something I can do to change it right now, well, we should cut our conversation short so you can go and take the action that would be helpful. But if you get a no to the first one, well, then we don't even need to go to the second question. No, there isn't a problem outside of me right now. It's just I'm thinking of one. or if there is, but there's not a blessed thing a person could do to change it, well, then we just have something we have to get used to. If you find when you ask yourself this question that you kind of resist yes or no answers and hear yourself answering along the lines of, couldn't it be that, let's suppose, what if, well, then you're there. If you don't get yeses, it's not a danger. So that's a nice question that people can use for them to help themselves, because they will feel afraid and they will tend to assume, if I'm afraid, then I'm in danger. But go see a scary movie or read a scary book and you'll be reminded we can become afraid when we know we're not in any danger. The two are not synonymous, and that misleads people so badly.
Mm-hmm. Right. That's great. I love that. Well, David, the other thing I think you've taught us therapists here in the Chicago community and folks who are not therapists is the use of humor too. So maybe we can have you come back again sometime just to talk about the use of humor in therapy, and maybe to talk a little bit about the therapy players. Do you have any performances coming up, and how are those happening right now?
Well, I could come back and talk for hours about humor and therapy and progress. It is such a powerful response. It's the highest and best response to anxiety. Lots and lots to say about that. Therapy players, we're experimenting with online shows. We're doing it like this, except there's 8 or 9 of us on the screen. We have a show we're going to coming up next weekend at what's called the Vintage Improv Festival. This is something interesting. It's a festival for improvisers who are 50 years and older.
Vintage.
Yeah. So old folks doing improv is where we're going to be playing next weekend. That's the weekend of September 11th. So we're doing online, experimenting with that and seeing how it goes.
I love it. We're all just having to MacGyver the world right now. I love it.
Yeah.
Well, if you can, I highly recommend tune into therapyplayers.com, see where they will be, get Dave's books. If you struggle with anxiety, or you know someone who struggles with an anxiety disorder or problems with anxiety, I don't like that term, anxiety disorder either. Outsmart Your Anxious Brain. Where can people get this, Dave?
I have them all on my website at anxietycoach.com.
Okay, wonderful, wonderful. Well, Dave, thank you so much. I really appreciate it. Some great perspective for people to be thinking about. We also, for therapists, and you know what, I mean, maybe for people who aren't, we're hosting Dave. He's going to come and join us for a 6-hour training. I'm so delighted. We did this a few years back. It was very, very successful. People got a lot out of it. Dave always gets super high marks for his presentations. He's very engaging, and you walk away with a lot of material that you can use right away with your clients. So if you can, please join us. You can go to our website to sign up at thejunipercenter.com. And if you're interested in seeing Dave speak more, we would love to see you then. It's a CEU event for therapists who need CEUs. So Dave, thank you so much for joining us today. Always good to see you. Come back and have breakfast with me again. I love it.
Thanks so much for having me. Always a pleasure.
Definitely. Thanks so much. Be well.
Alrighty.